Over the past few years, our department has started to implement simulation into our residency courses. The goal has been to provide more realistic hands-on experience for caregivers to learn. This presentation will review the progression of development of a positioning sim for the perioperative area. The 2022 needs assessment was used to determine needs for education. Positioning was listed as one of the high priority needs reported by caregivers. Reported instances of pressure injury incurred during surgery also showed need for education. Research shows the benefits of simulation training in improving retention of information, improving critical thinking, and building learner confidence. The current education on positioning in the OR for our OR residency consisted of a PowerPoint with minimal use of positioning equipment used in the actual setting. We wanted to improve education by implementing a pre-brief and debrief guide with guided talking points, implementation of actual equipment used in the setting, and to also improve caregiver interaction. A literature review revealed that many institutions use simulation for training. Studies have been done on the impacts of simulation on learners, but not many have been done showing the impact of simulation training for positioning with new OR caregivers specifically. The goals overall was to allow for hands-on positioning using actual equipment used in the setting, allowing for collaboration, brainstorming, and critical thinking, and safely positioning the patient. And also a future goal is to have a collaborative educational effort between nursing, physician assistants, and medical students. In looking at the progression and steps throughout the project, as mentioned, a literature review was done at the start to see if a project like this had already been done and to also look into the benefits and shortcomings of simulation in the hospital setting. Next, we reviewed the information from nursing quality about positioning injuries within our facility and used this information also to help build some of the case scenarios. To obtain needed equipment, meetings were had with management and the SIM Center about cost, center expense, and how to go about getting needed items for the simulation. I reached out to different service lines to collect donations and to collect equipment that they weren't using any longer. I also went to a storage space to see what could be salvaged from there. So we were able to get some donated items and some items that just weren't in use any longer. And other items were ordered using our capital expense budget and also ordered through the nursing simulation team. These items included yellow fan positioners, gel padding, prone view face pillow, bean bag, foam, chest rolls, and an axillary roll. And again, case scenarios were based off of the literature review and also incidents of actual injury of patients in our setting. A couple of meetings were held with the simulation team and the nursing SOS team to ensure all needed items were ordered, and then to come up with the actual plan for implementing the sim. They were very helpful in providing feedback and tips for carrying out the actual sim. The next step was to coordinate a dry run with my education team and also the simulation team. Throughout this dry run, we actually went through the scenario as if we would for a real class day, and going through step by step with each scenario and using the positioning equipment on a mannequin. Throughout the dry run, recommendations were made to make certain changes to the facilitator guide, and finally we came up with the final draft for the facilitator guide, and we were ready to implement. So this sim has been incorporated into the nursing OR residency. We've had 3 or 4 courses so far. Next steps are to review future OR positioning injury reports to see if there is an actual reduction in patient injury. Also to look at caregiver evaluations to see actual benefits to caregivers and to see if any adjustments need to be made. And then lastly, to report out and disseminate this information to other teams throughout the enterprise to be used as a framework and something that other caregivers can build off of. And again, as stated, to eventually incorporate this into interdisciplinary training, to have training between residents, PAs, and nursing in the future. Thank you.